What if there was a way to heal your pancreas without drugs, without surgery, without invasive procedures? What if ancient healing systems combined with modern science could reverse chronic pancreatitis, improve enzyme production, and restore digestive function? Peter Melamed, Ph.D., along with his son Felix Melamed, have created a comprehensive guide to non-drug treatments that millions around the world have used successfully for over 250 years. Part 3 of Healthy Pancreas, Healthy You, reveals something revolutionary. You can improve pancreatic function, postpone pancreatic deterioration, and heal digestive disorders through proven natural therapies. This is not wishful thinking or alternative medicine mythology. This is documented clinical experience backed by over 300 scientific references from respected professors, researchers, and medical doctors worldwide. The pancreas is vital for digestion and metabolism. When it fails, your entire body suffers. But when you support it with the right natural therapies, healing becomes possible. The question is, are you ready to explore options your doctor may have never mentioned? The European approach that conventional medicine ignores. Western medicine typically addresses pancreatic problems with a limited toolkit: pain medications, enzyme replacement, dietary restrictions, and eventually surgery when the pancreas fails completely. This approach manages symptoms but rarely addresses the underlying causes of pancreatic dysfunction. European and Asian medical systems have taken a different path for centuries. They recognize that the body has innate healing capacity when given proper support. They use natural therapies that work with the body rather than simply suppressing symptoms. These approaches are not experimental or unproven. They have been used successfully in major European clinics and hospitals for generations. The problem is that most Americans have never heard of them. Peter Melamed established biotherapy in 1975 as a natural, holistic approach to healing. His system combines the wisdom of traditional Russian folk medicine, ancient Oriental medical therapies, and European naturopathy with cutting-edge Western technology. After immigrating to the United States in 1991 and obtaining licenses to practice acupuncture and herbal medicine, he founded the Biotherapy Alternative Medicine Clinic in San Francisco. For over 40 years, he has specialized in treating difficult cases of pancreatic and digestive disorders using non-drug approaches. His clinical experience demonstrates that many people who were told their pancreatic problems were untreatable have achieved significant improvement through natural therapies. A woman named Diane had suffered from chronic pancreatitis for 6 years. Her gastroenterologist managed her pain with medications but offered no hope for improvement. He explained that her pancreas was permanently damaged and she would need enzyme supplements for life. Diane felt defeated until she discovered the biotherapy approach. She began a comprehensive protocol combining Karlovy, very healing mineral water, acupuncture, herbal medicine, nutritional supplementation, and healing foods. Within 3 months, her pain had reduced by 60%. Within 8 months, her pancreatic enzyme levels on blood tests had improved measurably. Her gastroenterologist was surprised, admitting he had never seen such improvement in a chronic pancreatitis patient. Diane had proven that natural therapies could accomplish what conventional medicine said was impossible. Karlovy, very healing mineral water. The foundation therapy. One approach that is virtually unknown in the United States is drinking healing mineral water prepared from genuine Karlovy very thermal spring salt. Millions of people around the world have used this miracle mineral water to aid digestive health for more than 250 years. European doctors have prescribed Karlovy very water for pancreatic disorders, liver problems, gallbladder disease, gastritis, and metabolic conditions since the 1700s. This is not folk remedy or unproven treatment. This is established medical therapy taught in European medical schools and used in major European clinics. Karlovy very thermal spring is located in the Czech Republic. The water emerges from deep underground at a temperature of 162 degrees Fahrenheit. Carrying a unique combination of minerals, trace elements, and bicarbonate. Chemical analysis shows the water contains magnesium, calcium, potassium, sodium, lithium, sulfate, chloride, fluoride, and over 40 trace elements in specific ratios that support pancreatic function. The high bicarbonate content creates an alkaline environment in the duodenum where pancreatic enzymes activate and function. Since 1764, people who cannot travel to Karlovy Vary have been able to purchase genuine thermal spring salt. Dissolve it in water at home and obtain the same healing benefits as drinking the water at the spring. Dr. Vaclav Sklunovsky, a Czech physician who has studied Karlovy Vary water for decades, documented in clinical trials that patients with chronic pancreatitis who drink this mineral water experience reduced pain, improved enzyme production, decreased inflammation, and better nutritional status compared to control groups receiving standard treatment alone. The mechanisms are multiple. The alkaline minerals neutralize metabolic acidosis that damages the pancreas. The trace elements provide raw materials needed for enzyme synthesis. The warm water stimulates blood flow and pancreatic juice secretion. The bicarbonate creates the alkaline duodenal environment essential for enzyme activation. A man named Edward had chronic pancreatitis with constant abdominal pain, poor appetite, weight loss, and fatty stools indicating malabsorption. His doctor prescribed pancreatic enzymes and pain medication but explained there was no cure. Edward researched natural therapies and discovered Karlovy Vary healing mineral water. He ordered genuine thermal spring salt and began drinking the mineral water 3 times daily before meals as directed. Within 2 weeks, his pain intensity decreased noticeably. Within 6 weeks, his appetite returned and his stools normalized. Within 3 months, he had gained back 12 pounds and his energy had improved dramatically. Blood tests showed his pancreatic enzyme levels rising and inflammation markers decreasing. His doctor was baffled, unable to explain the improvement. Edward knew the mineral water was providing his pancreas exactly what it needed to heal. Alkaline minerals, essential trace elements, and compounds that stimulate healthy function. Acupuncture. The nervous system reset for digestive function. Acupuncture may surprise many people as a treatment for pancreatic disorders. How can inserting needles into specific body points affect an internal organ like the pancreas? The answer lies in understanding the nervous system connections between the body surface and internal organs. Traditional Chinese medicine recognized these connections thousands of years ago through clinical observation. Modern research has confirmed the neurological pathways that explain how acupuncture works. Dr. Zhonghee Cho from the University of California, Irvine, used functional MRI, brain imaging, to demonstrate that stimulating specific acupuncture points produces measurable changes in brain activity in regions that control the corresponding organs. Acupuncture for digestive points activates the parasympathetic nervous system, which controls digestion. It reduces pain by stimulating endorphin release. It decreases inflammation by modulating immune responses. It improves blood flow to organs by releasing nitric oxide, which dilates blood vessels. For pancreatic disorders, acupuncture addresses multiple therapeutic goals simultaneously. It reduces abdominal pain and cramping that are common in pancreatitis and pancreatic insufficiency. It stimulates pancreatic juice secretion and enzyme production. It regulates the sphincter of Oddi, the valve that controls release of pancreatic enzymes and bile into the intestine. When this sphincter is in spasm, digestive juices back up, causing pain and inflammation. Acupuncture relaxes the sphincter, allowing proper flow. It reduces nausea and improves appetite, which are often impaired in pancreatic patients. It addresses the whole body acidity and stress that contribute to pancreatic dysfunction. Dr. John Longhurst from the University of California, Irvine, has published extensive research on acupuncture's cardiovascular and gastrointestinal effects. His studies demonstrate that electroacupuncture at specific points significantly reduces gastric acid secretion and decreases visceral pain through measurable neurological mechanisms. The effects are not placebo. They are reproducible physiological responses mediated through the autonomic nervous system. A woman named Gloria had sphincter of Oddi dysfunction following gallbladder removal surgery. She experienced severe pain in her upper right abdomen, nausea after meals, and intermittent diarrhea. Her gastroenterologist diagnosed the sphincter problem through specialized testing, but offered only medications that provided minimal relief. Gloria began acupuncture treatments twice weekly. The first session produced immediate pain reduction that lasted several hours. After 4 sessions, her pain frequency had decreased by half. After 12 sessions over 6 weeks, her symptoms had improved 70%. She continued maintenance treatments monthly and remained largely symptom-free. Her quality of life had been restored through acupuncture when conventional medicine had failed to provide adequate relief. Herbal medicine, botanical compounds that support pancreatic healing. Herbs have been used to treat digestive and pancreatic disorders in traditional medical systems for thousands of years. Modern research has identified many of the active compounds responsible for their therapeutic effects. Unlike pharmaceutical drugs that typically contain a single active ingredient, herbs contain dozens or hundreds of bioactive compounds that work synergistically. This makes them gentler and often more effective for chronic conditions like pancreatic dysfunction. Several herbs demonstrate specific benefits for pancreatic health. Turmeric contains curcumin, which reduces pancreatic inflammation, protects pancreatic cells from oxidative damage, and may help prevent pancreatic fibrosis. Ginger stimulates digestive enzyme production, reduces nausea, and has anti-inflammatory effects. Licorice root has been used in Chinese medicine to treat pancreatitis for centuries. Research shows it reduces pancreatic inflammation and protects against alcohol-induced pancreatic damage. Milk thistle protects liver and pancreatic cells through its active compound silymarin, which has powerful antioxidant and anti-inflammatory properties. Gentian root stimulates bile and pancreatic juice secretion, improving digestion. Dandelion root supports liver and pancreatic function while promoting healthy bile flow. Dr. Bharat Agarwal from the University of Texas MD Anderson Cancer Center has researched curcumin extensively. His studies demonstrate that curcumin modulates over 30 different signaling pathways involved in inflammation, cell survival, and apoptosis. For pancreatic conditions, curcumin reduces the inflammatory cytokines that drive chronic pancreatitis, protects pancreatic beta cells that produce insulin, and may help prevent progression from pancreatitis to pancreatic cancer. The challenge with curcumin is poor absorption. When combined with piperine from black pepper and taken with fats, absorption increases dramatically. Herbal formulas used in biotherapy often combine multiple herbs to address different aspects of pancreatic dysfunction simultaneously. One herb reduces inflammation. Another stimulates enzyme production. A third supports liver detoxification. A fourth restores beneficial gut bacteria. The synergy creates therapeutic effects greater than any single herb alone. A man named Walter had chronic pancreatitis with persistent abdominal pain despite pain medications. His doctor added stronger painkillers, but Walter wanted to avoid long-term narcotic use. He consulted with a practitioner trained in herbal medicine who created a custom formula containing turmeric, ginger, licorice, and several other herbs targeting inflammation, pain, and digestive function. Walter began taking the herbal formula 3 times daily. Within 2 weeks, his pain intensity had decreased enough to reduce his pain medication dose. Within 6 weeks, he had eliminated narcotic painkillers entirely, managing his pain with the herbal formula and occasional over-the-counter medications. His quality of life improved dramatically. He felt mentally clear without the fog from narcotics. His digestion improved. His energy returned. The herbs were addressing the underlying inflammation and dysfunction rather than simply masking symptoms. Nutritional supplementation. Targeted support for enzyme production, while Part 2 addressed healing foods. Part 3 focuses on concentrated nutritional supplements that provide therapeutic doses of specific nutrients critical for pancreatic function. People with compromised pancreatic function have significantly higher nutrient requirements than healthy individuals. Food alone, particularly when digestion and absorption are impaired, often cannot provide adequate amounts. Supplementation becomes essential for healing. The pancreas requires specific nutrients to produce enzymes, maintain cellular structure, and protect against oxidative damage. A comprehensive supplementation program for pancreatic health typically includes digestive enzymes to reduce the workload on the pancreas while it heals. Pancreatic enzyme supplements containing lipase, protease, and amylase help digest fats, proteins, and carbohydrates when natural production is insufficient. Probiotics to restore beneficial gut bacteria that protect the pancreas from gut-derived toxins. High-potency B-complex vitamins, particularly B5, which is essential for enzyme synthesis. Zinc, which is required for pancreatic enzyme production and insulin function. Magnesium, which activates over 300 enzymatic reactions, including those in the pancreas. Omega-3 fatty acids to reduce inflammation and support cell membrane integrity. Antioxidants, including vitamins C and E, selenium, and alpha-lipoic acid, to protect pancreatic cells from oxidative damage. Coenzyme Q10 to support cellular energy production in pancreatic tissue. Dr. Abram Hoffer, a Canadian psychiatrist who pioneered orthomolecular medicine, demonstrated that many chronic diseases respond to nutritional therapy with doses far exceeding recommended daily allowances. His work with niacin showed that therapeutic doses of 1,000 to 3,000 milligrams daily could correct metabolic disorders that did not respond to low doses. The same principle applies to pancreatic healing. Meeting the RDA is inadequate. Therapeutic doses tailored to individual needs produce results. A woman named Patricia had exocrine pancreatic insufficiency with severe malabsorption. She experienced chronic diarrhea, weight loss, and vitamin deficiencies despite eating well. Her doctor prescribed pancreatic enzyme supplements, which helped somewhat but did not fully resolve her symptoms. She began a comprehensive supplementation program, including high-dose digestive enzymes, probiotics, B-complex vitamins, zinc, magnesium, and omega-3 fatty acids. Within 4 weeks, her bowel movements normalized for the first time in 2 years. Within 8 weeks, she had gained 8 pounds. Within 12 weeks, blood tests showed her vitamin levels rising into normal ranges. The targeted supplementation provided what her pancreas and digestive system desperately needed to restore function. Visceral massage and exercises. Physical support for organ function. Visceral manipulation is a gentle manual therapy technique that addresses the mobility and motion of internal organs. Developed by French osteopath Jean-Pierre Borel, visceral manipulation recognizes that organs need to move freely in relation to surrounding structures for optimal function. When adhesions, inflammation, or tension restrict organ movement, function deteriorates. For the pancreas, which sits deep in the abdomen surrounded by other organs and connected to the duodenum through ducts, restricted mobility can impair enzyme flow and contribute to dysfunction. Trained practitioners use gentle palpation and manipulation to release restrictions, improve circulation, and restore normal organ mobility. Research published by the Borel Institute documents that visceral manipulation improves digestive function, reduces pain, and enhances organ performance through measurable physiological mechanisms. Abdominal self-massage techniques can also support pancreatic and digestive health. Gentle clockwise massage of the abdomen following the path of the colon promotes peristalsis and prevents constipation. Massage over the pancreatic area in the upper left abdomen can improve circulation to the organ. These techniques are particularly valuable for people with chronic digestive problems who experience bloating, cramping, and sluggish bowel function. Specific exercises that involve twisting and bending the trunk stimulate internal organs, including the pancreas. Yoga poses like seated twists, supine twists, and forward bends gently compress and release abdominal organs, promoting circulation and function. Diaphragmatic breathing, which many people have lost through chronic stress and shallow chest breathing, massages internal organs with each breath. The downward movement of the diaphragm during inhalation compresses abdominal organs, improving blood flow. The upward movement during exhalation releases compression, allowing fresh blood to enter. This rhythmic massage occurs thousands of times daily when breathing is correct. A man named Kenneth had chronic pancreatitis with persistent upper abdominal discomfort and bloating. His gastroenterologist found no acute inflammation on imaging, but acknowledged he had chronic changes in the pancreas. Kenneth began working with a physical therapist trained in visceral manipulation. The therapist identified significant restrictions in the mobility of his stomach, duodenum, and pancreatic area. After 6 sessions of gentle visceral manipulation combined with instruction in abdominal self-massage and breathing exercises, Kenneth's symptoms had improved 60%. He felt less bloating, his digestion was more comfortable, and the chronic dull ache in his upper abdomen had diminished significantly. The physical restrictions that had been impairing organ function were released, allowing better circulation and drainage. Whole body cleansing and colon hydrotherapy, removing toxic burden. One of the most overlooked aspects of pancreatic health is the toxic burden from intestinal dysbiosis, constipation, and accumulated waste in the colon. The colon and pancreas may seem unrelated, but they are intimately connected through the circulation. Toxins produced by harmful gut bacteria and decomposing waste in a sluggish colon enter the bloodstream and travel to the liver and pancreas. These organs must detoxify the blood, placing additional stress on already compromised function. When the colon is cleansed and beneficial bacteria are restored, the toxic load on the pancreas decreases dramatically. Whole body cleansing programs typically begin with colon cleansing through increased fiber intake, herbal laxatives, enemas, or colon hydrotherapy. Colon hydrotherapy, also called colonics, involves gentle infusion of warm water into the colon to soften and remove accumulated waste. This is followed by restoration of beneficial intestinal flora through high-dose probiotics and fermented foods. Liver support through herbs like milk, thistle, and dandelion helps the liver detoxify more efficiently, reducing the burden on the pancreas. Dr. Bernard Jensen, a pioneering chiropractor and nutritionist who specialized in colon health, documented through decades of clinical experience that many chronic diseases improve dramatically when the colon is cleansed and beneficial bacteria are restored. His book, Tissue Cleansing Through Bowel Management, presents case studies of patients whose digestive problems, skin conditions, joint pain, and fatigue resolved through colon cleansing protocols. The mechanisms are straightforward. When harmful bacteria dominate the gut, they produce endotoxins, ammonia, and other toxic compounds that enter the bloodstream. When beneficial bacteria dominate, they produce vitamins, short-chain fatty acids, and compounds that support immune function and reduce inflammation. A woman named Sharon had chronic pancreatitis, severe constipation, and persistent bloating. Her gastroenterologist prescribed laxatives for the constipation but never connected her bowel problems to her pancreatitis. Sharon began a whole-body cleansing program including colon hydrotherapy sessions, high-dose, probiotics, and herbal antimicrobials to address intestinal dysbiosis. Within 3 sessions, her constipation resolved. Within 6 sessions, her bloating had improved 70%. Most remarkably, her pancreatic pain decreased significantly. Her next blood test showed inflammation markers had dropped. Removing the toxic burden from her gut had reduced the stress on her pancreas, allowing it to heal. Hypnosis and stress management. The mind-body connection. Stress is one of the most underestimated contributors to pancreatic dysfunction. Chronic stress elevates cortisol, which impairs digestion, promotes inflammation, and disrupts pancreatic function. The autonomic nervous system controls pancreatic enzyme secretion and bile release. When you are chronically stressed, the sympathetic nervous system dominates, shutting down digestive function. The parasympathetic nervous system, which controls digestion, cannot activate properly. Hypnosis is a powerful tool for activating the parasympathetic nervous system and reducing the stress response. Medical hypnosis is not stage hypnosis or mind control. It is a state of focused attention and deep relaxation that allows access to the subconscious mind. Research has demonstrated that hypnosis can reduce pain, improve digestive function, and accelerate healing through measurable physiological changes. Dr. David Spiegel from Stanford University has published extensive research on medical hypnosis for pain management and disease treatment. His studies show that hypnosis reduces pain perception through changes in brain activity in regions that process pain signals. For irritable bowel syndrome, which shares many features with functional pancreatic disorders, hypnosis has been shown in multiple clinical trials to be as effective as medications with no side effects. The mechanisms involve reducing visceral hypersensitivity, normalizing gut motility, and addressing the anxiety and stress that exacerbates symptoms. For pancreatic patients, hypnosis can reduce abdominal pain, decrease stress-induced enzyme secretion abnormalities, improve sleep quality, and enhance overall quality of life. Guided imagery techniques where patients visualize their pancreas healing, inflammation resolving, and function restoring create neurological changes that support actual physiological healing. A man named Arthur suffered from chronic pancreatitis with debilitating pain that controlled his life. He was on multiple pain medications but still experienced breakthrough pain daily. His anxiety about the pain made it worse, creating a vicious cycle. He began working with a clinical hypnotherapist trained in pain management. Through hypnosis sessions, Arthur learned to enter deep relaxation states where pain perception decreased dramatically. He practiced self-hypnosis daily, using audio recordings. Over 3 months, his pain medication requirements decreased by 60%. More importantly, his relationship with the pain changed. He no longer felt victimized by it. He had tools to manage it. His stress levels decreased, which reduced the stress-induced exacerbations of his pancreatitis. The mind-body connection that had been amplifying his suffering was transformed into a healing resource, integrating natural therapies into a comprehensive healing program. The power of Part 3 lies not in any single therapy, but in the synergistic combination of multiple natural approaches addressing different aspects of pancreatic dysfunction simultaneously. Karlovy, very healing mineral water, provides alkaline minerals and trace elements. Acupuncture regulates the nervous system and reduces inflammation. Herbs deliver botanical compounds that support healing. Nutritional supplements provide concentrated nutrients. Visceral manipulation improves physical mobility and circulation. Colon cleansing reduces toxic burden. Hypnosis addresses stress and activates parasympathetic healing responses. When these therapies work together, they create a comprehensive healing environment that allows the pancreas to repair and regenerate. Peter Melamed emphasizes that healing pancreatic disorders requires patience and commitment. The pancreas did not fail overnight. It deteriorated gradually over months or years through accumulated stress, poor nutrition, metabolic acidosis, intestinal dysbiosis, alcohol, and other factors. Healing requires reversing these processes, which takes time. But thousands of patients have proven that natural therapies can improve pancreatic function, even in cases where conventional medicine offered no hope. The key is working with practitioners experienced in these approaches. Reading books provides knowledge, but implementing an effective healing program requires professional guidance. Blood tests, symptom tracking, and periodic reevaluation allow practitioners to adjust the protocol based on individual response. Some people improve rapidly. Others require many months of consistent treatment. Success depends on addressing all the factors that contributed to pancreatic dysfunction in the first place. Diet must change. Stress must be managed. Gut health must be restored. Toxic exposures must be eliminated. Nutritional deficiencies must be corrected. Only then can natural therapies produce their full healing potential. Your pancreas wants to heal. Your body has innate regenerative capacity when given proper support. Conventional medicine often underestimates this capacity, declaring conditions irreversible when they are not. Natural medicine, grounded in centuries of clinical experience and increasingly supported by modern research, offers hope where conventional approaches reach their limits. The therapies described in Part 3 are not experimental or unproven. They are established treatments used successfully in major clinics worldwide. The question is not whether they work. The question is whether you will give yourself the opportunity to experience their benefits. Your pancreas is waiting for the support it needs. These natural therapies provide the path. Thank you for watching this summary of Healthy Pancreas, Healthy You Part 3 by Peter Malamud, PhD, and Felix Malamud. If this information has opened your eyes to natural treatment options for pancreatic health, please subscribe to our channel for more evidence-based book summaries that can transform your life. Visit our channel for complete detailed breakdowns of Part 1 covering pancreatic structure and disorders, and Part 2 explaining healing foods and dietary approaches. Your pancreas can heal naturally with the right support. Start your healing journey today.